Hi, my name is Abria Bennett and I'm a student nurse at the University of South Alabama. Today I'll be performing the musculoskeletal assessment. I'd first like to acknowledge that I have performed hand hygiene, and I will begin by inspecting and palpating my patient's musculoskeletal system. Okay? Inspecting. Now palpating. I would like to note that my patient's skin color is brown. I did not find any masses, deformities, any swelling, and I would like to note that my patient's temperature was warm during the palpation. Now I will move on to assessing and testing my patient's grade for the resistance in the upper and lower extremities. For the upper extremities, I will be testing this with the tricep and the bicep. Okay? I just need you to push against resistance for whatever part of the body that I'll be touching. Okay? First, the upper extremities, I'm going to push back. Okay, good. Now, I'm pushing forward. Okay, good. I will grade this a 5 out of 5. Now, for the lower extremities, I'll place my hands on my patient's knees, and I will ask my patient to push up as I'm pushing down. Okay, good. Now, I will go down to my patient's legs, pushing back. Okay, good. Now, I will push going forward, my patient's leg. Good. So I would like to note that my patient will be graded a 5 out of 5 for the resistance. Now what I will do is I will assess the active range of motion for each joint for no audible crepitation. First, the mouth. Can you do this? Open it maximally. Now the joint side to side of the jaw. Now to protrude the joints of the jaw. Okay? And now to stick out the lower jaw. Okay, so my patient has done that. Now what we would do is move on to the neck, and I will have my patient to stand from here. First, I will have my patient to move their neck towards their chest. Now I'll have my patient to hyperextend. Okay, now I will have my patient to not move his shoulders, moving his ears to his shoulders, both sides. Okay. Now what I will have my patient to do next is I will have him to then look at the door, not moving his shoulders, okay? And then the other side, look towards me, not moving his shoulders, okay? Good. The next thing that we will do is we will go to the range of motion for these shoulders. I will first have my patient to flex, then I'll have my patient to extend, then I'll have my patient to hyperextend, okay? After hyperextending, I will have my patient to abduct, then to adduct. I will have my patient to do the internal rotation, which is this, okay? Okay, and I will have my patient to do the external rotation. Good. Okay, now what I will do is I will have my patient to do this for the elbow. I'll have my patient to flex his elbows. Good. Extend your elbows. Okay. Now we will demonstrate supination. Now pronation. Good. Now we will move on to the flexion of the wrist in the hand. I will have my patient to do the wrist first. So flexion. Okay. Now extension. Now hyper extension. Now just the fingers only. Not the wrist, flexion, okay, extension, hyperextension. Now we're going to measure radial deviation like this, okay, ulnar deviation. Now what we will do is we will make a fist, spread the fingers out, and I will have you to then touch each finger with the base of your thumb like this on both hands. Good. Okay, now what we'll do is the hip. I will have my patient to, you can hold on to the dresser if you need. I will have you to flex, okay, then extend. I will need you to now hyperextend, okay. I will need you to abduct, okay. Now bringing it back is abducting, okay. Now I will have my patient to do an internal rotation like this. Okay, now external rotation. Good. Now we will go to the knee. We will do flexion. Good. Then extension. Okay. And now we will do the ankle and the foot. We will do a plantar flexion. Good. Now we'll do a dorsiflexion, which is down. Okay. What we'll do now is the eversion, which is the sole pointing outwards, like this. Good. The inversion with the sole pointing inwards. Good. Now we will do the, I will have you take off your socks. Okay, and I will have you to curl your toes for flexion. Okay, and for extension, and hold your toes out straight forward. Good. So now what I will do now is I will assess the active range of motion for my patient's spine. Okay, so I have you to do flexion, extension, and hyperextension 30 degrees with your head tilted backwards. Good. Now what we will do is we will bend laterally, not moving your hips. This way. Good. Now this way. Okay. Now the last thing that we will do is I will have my patient to twist his shoulders without moving his hips, keeping them stationary like this. Okay. Now the other direction. Good. Now what we will do is we will inspect the spine and describe the spine. Okay. Okay. Could you take your shirt off for me, please? Okay, so what I will do is I was inspecting and describing the spine, okay? From the neck to the gluteal cleft, I am noting that the alignment is straight, and I would also like to note that my patient is concave at the cervical, convex at the thoracic, and concave at the lumbar. Now I will assess for scoliosis by asking my patient to bend at the waist, and I will observe for any elevation of the shoulder, the level of the scapula, or at the iliac crest. Okay, because you've been at the waist. Okay. Okay. I would like to note that my patient does not have scoliosis and that my patient did not have any audible crepitation. Thank you, and this will conclude my health assessment skill for the musculoskeletal assessment. Thank you.